Welcome back to the Nurses Study Partner. This is Pyelonephritis Part 1, the Foundations, in 10 in-depth scenarios. We'll recognize this upper urinary tract infection, name its usual cause, tell it apart from cystitis, elicit the classic flank sign, read the urine, and give safe supportive care while watching for sepsis. Read each case, weigh all four options, pause to choose, then check your reasoning. Let's begin. Question 1. A 24-year-old woman presents with a fever of 39 degrees and shaking chills, right flank pain, and burning on urination with frequency. Tapping over her right costovertebral angle is markedly tender. Which condition is most likely? Option A, acute pyelonephritis, an upper UTI. Option B, a simple lower UTI, cystitis alone. Option C, an uncomplicated case of ordinary constipation. Option D, a pulled muscle in the back from exercise. Pause here and choose your answer. The answer is A, acute pyelonephritis. Fever with chills, flank pain, costovertebral angle tenderness, plus burning and frequency are the classic picture of infection of the kidney itself. Cystitis alone would not cause the fever, chills, or flank tenderness, and constipation or a muscle strain would not cause burning urine with fever. Question 2. A patient with acute pyelonephritis has a urine culture pending. Which organism most commonly causes this infection, and by what route does it usually reach the kidney? Option A, Staphylococcus aureus spread through the blood. Option B, Escherichia coli ascending from the bladder. Option C, a fungal spore inhaled into the lungs. Option D, a virus caught from contaminated food. Pause here and choose your answer. The answer is B, Escherichia coli ascending from the bladder. E. coli, a gram-negative gut organism, causes around 80% of cases and usually reaches the kidney by ascending up from a bladder infection. Blood-borne spread is far less common, and fungi or food-borne viruses are not the usual cause of pyelonephritis. Question 3. Two women attend the clinic. One has only burning and frequency with suprapubic discomfort and no fever. The other has burning and frequency plus a high fever, chills, and marked flank tenderness. How are these two best distinguished? Option A. Both simply have the same lower urinary tract infection. Option B. The first has pyelonephritis, the second has cystitis. Option C. The first has cystitis, the second has pyelonephritis. Option D. Neither woman has any urinary tract infection at all. Pause here and choose your answer. The answer is C. The first has cystitis and the second has pyelonephritis. Cystitis, a lower UTI, causes burning, frequency, and suprapubic discomfort without fever or flank pain. Pyelonephritis, an upper UTI, adds fever, chills, and flank tenderness, showing the kidney is involved. So the two are different and not the other way around. Question 4. A nurse is identifying patients at higher risk of pyelonephritis so they can be monitored and treated early. Which factor most increases the risk? Option A, a high daily intake of plain drinking water. Option B, regular complete emptying of the bladder. Option C, being physically active and well hydrated. Option D, urinary obstruction or vesico-urethral reflux. Pause here and choose your answer. The answer is D, urinary obstruction, or vesico-urethral reflux. Anything causing urinary stasis or reflux, obstruction from stones or an enlarged prostate, reflux especially in children, pregnancy, diabetes, catheters, and immunosuppression raises the risk. Good hydration and regular complete bladder emptying are actually protective. Question 5. A nurse suspects pyelonephritis in a febrile patient and wants to elicit the classic bedside sign of kidney involvement. Which assessment technique is most appropriate? Option A, gently percuss over the costovertebral angle for tenderness. Option B, press deeply on the lower abdomen to find rebound pain. Option C, listen over the neck vessels for a carotid bruit. Option D, tap the knee tendon to test the reflex response. Pause here and choose your answer. The answer is A. Gently percuss over the costovertebral angle for tenderness. Costovertebral angle tenderness, pain when the flank over the kidney is gently percussed, is the classic bedside sign of pyelonephritis. Abdominal rebound, a carotid bruit, or a knee reflex test, entirely different problems. Question 6. A patient with suspected pyelonephritis is about to be started on antibiotics, and the nurse is planning the correct sequence of care. Which action should come first? Option A. Start the antibiotics at once, then think about tests. Option B. Give a strong painkiller and delay all investigations. Option C. Collect a urine and any blood culture before antibiotics. Option D. Wait several days before doing anything at all. Pause here and choose your answer. The answer is C. Collect a urine and any blood culture before antibiotics. Cultures should be taken before antibiotics start so the organism and its sensitivities can be identified, with empirical antibiotics then following promptly. Starting antibiotics first can mask the culture, and delaying care risks progression to urosepsis. Question 7. The urinalysis of a patient with suspected pyelonephritis shows numerous white cells, positive nitrites and leukocyte esterase, bacteria, and white cell casts. What do the white cell casts specifically indicate? Option A, that the infection is confined to the bladder only. Option B, involvement of the kidney, the upper urinary tract. Option C, a completely normal and healthy urine sample. Option D, a purely glomerular disease with no infection. Pause here and choose your answer. The answer is B, involvement of the kidney, the upper urinary tract. Pyuria, nitrites, leukocyte esterase, and bacteria indicate a urinary infection, but white cell cast specifically points to the kidney, pyelonephritis, rather than cystitis. Casts form in the renal tubules, so they are not a bladder-only or normal finding, and red cell casts, not white, would suggest glomerular disease. Question 8. A patient admitted with acute pyelonephritis has a high fever, rigors, flank pain, and nausea, and the nurse is planning supportive care alongside the antibiotics. Which set of nursing measures is most appropriate? Option A. Restrict all fluids and withhold any pain relief now. Option B. Keep the patient nail by mouth and immobile all day. Option C. Ignore the temperature and simply observe him quietly. Option D. Encourage fluids, treat fever and pain, monitor vitals. Pause here and choose your answer. The answer is D. encourage fluids, treat fever and pain, and monitor vitals. Supportive care means encouraging fluids unless contraindicated, giving antipyretics for the fever and analgesia for the flank pain, and closely watching vital signs and urine output to catch any slide towards sepsis. Restricting fluids, withholding pain relief, or ignoring the fever would all be inappropriate. Question 9. An 82-year-old woman is brought in newly confused and generally unwell, with a low-grade fever but no clear urinary complaints. Her urine is cloudy and strong smelling, and she is mildly tender in one flank. Which possibility should the nurse particularly consider? Option A, pyelonephritis presenting atypically in an older adult. Option B, a completely normal state for someone of her age. Option C, a purely psychiatric problem unrelated to infection. Option D, simple tiredness that needs no further assessment. Pause here and choose your answer. The answer is A, pyelonephritis presenting atypically in an older adult. In older people, urinary infection, including pyelonephritis, can show up as new confusion and being generally unwell, rather than classic burning or flank pain. Cloudy, strong-smelling urine and flank tenderness support it. New confusion in an older person should always prompt a search for infection, not be written off as normal aging, a psychiatric issue, or simple tiredness. Question 10. A patient with pyelonephritis becomes increasingly unwell. The blood pressure falls to 86/50. The heart rate rises to 122. The temperature is 39.5, and he is newly confused and breathing fast. Which complication is developing and what is the priority? Option A, a minor flare that needs only oral fluids at home. Option B, simple anxiety that will settle with reassurance. Option C, urosepsis, escalate for urgent fluids and antibiotics. Option D, a normal response to infection, just keep observing. Pause here and choose your answer. The answer is C, urosepsis, escalate for urgent fluids and antibiotics. Falling blood pressure, a fast heart rate, a high fever, new confusion and fast breathing in a patient with pyelonephritis signal urosepsis, sepsis from a urinary source. The priority is to escalate urgently for IV fluids, antibiotics, and full sepsis care. This is not a minor flare, anxiety, or a normal response. Urinary infections are a major cause of severe sepsis. Let's recap pyelonephritis part 1. It is an upper urinary tract infection. Fever, chills, flank pain, and costovertebral angle tenderness, usually with burning and frequency. The usual cause is E. coli ascending from the bladder. Cystitis has no fever. Pyelonephritis adds fever and flank pain. Risk rises with obstruction, reflux, pregnancy, diabetes, and catheters. Elicit the flank sign by percussing the costovertebral angle. Take cultures before starting antibiotics, and remember, white cell casts point to the kidney. Give fluids, antipyretics, analgesia, and close monitoring. Older adults may just be confused. And always watch for urosepsis. Fever with a falling blood pressure and confusion means escalate fast. Keep going, and remember, we don't pass alone, we pass together.